Hello, everyone. Welcome back to our health and wellness channel. Today, we're diving into an important topic that affects millions worldwide. What are the most common respiratory diseases? Whether it's the cold air during winter or the pollen in spring, our respiratory system is constantly under siege. The consequences of leaving these respiratory diseases unchecked can be dire. They range from reduced productivity and daily discomfort to severe health complications, hospitalizations, and sadly, in some cases, death. Chronic diseases like COPD can lead to a progressive loss of lung function, making every breath a struggle. How aware are you of the respiratory diseases that could be lurking around you? Do you know the steps you can take to minimize your risk and protect your lung health? So, let's explore what these diseases are, how they impact us, and why it's crucial to be informed. The most common respiratory diseases can be categorized into infections, chronic conditions, and acute conditions. Here's a list covering a range of these diseases. 1. Infections. Common cold, caused by various viruses, leading to a runny nose, sore throat, coughing, and sneezing. Influenza, flu, a viral infection affecting the nose, throat, and lungs, often seasonal. Pneumonia, infection that inflames air sacs in one or both lungs, which may fill with fluid. Tuberculosis, TB, a serious bacterial infection that primarily impacts the lungs. COVID-19, caused by the SARS-CoV-2 virus, affecting the respiratory system with symptoms ranging from mild to severe. 2. Chronic conditions. Asthma, a condition in which your airways narrow and swell, producing extra mucus. This can make breathing difficult and trigger coughing, wheezing, and shortness of breath. Chronic obstructive pulmonary disease, COPD, a group of diseases that cause airflow blockage and breathing-related problems, including emphysema and chronic bronchitis. Cystic fibrosis, a genetic disorder that causes severe damage to the lungs, digestive system, and other organs. Pulmonary fibrosis, a condition in which lung tissue becomes damaged and scarred, leading to serious breathing problems. 3. Acute conditions. Bronchitis, inflammation of the lining of your bronchial tubes, which carry air to and from your lungs. Pleural effusion, a condition where excess fluid builds up in the pleural space, the area between the layers of tissue that line the lungs and chest cavity. 4. Others. Lung cancer, a form of cancer that begins in the lungs. Sleep apnea, a serious sleep disorder in which breathing repeatedly stops and starts during sleep. Pulmonary hypertension, high blood pressure in the arteries to your lungs, making the right side of the heart work harder than normal. These diseases range from mild and self-limiting to chronic conditions requiring lifelong management, and in some cases, they can be life-threatening, necessitating prompt medical attention. To prevent or minimize the impact of respiratory diseases, it is crucial to implement several measures. First, maintaining personal hygiene and the cleanliness of our surrounding environment helps reduce the risk of infection. Regularly washing hands with soap, using alcohol-based hand sanitizers, and avoiding close contact with sick individuals are basic but effective measures. Second, getting vaccinated against diseases like influenza, pneumonia, and COVID-19 helps the body develop immunity, reducing the risk of getting sick and lessening the severity if infected. Vaccination not only protects oneself but also contributes to community protection through herd immunity. Third, maintaining a healthy lifestyle plays a significant role in preventing respiratory diseases. Eating a balanced diet rich in vitamins and minerals, exercising regularly, not smoking, and limiting exposure to smoke and other pollutants strengthen the immune system, helping the body to fend off bacterial and viral invasions. Lastly, keeping living and working spaces well ventilated, clean, and free from allergens such as dust, pet dander, and mold is also crucial in preventing respiratory diseases, especially asthma and allergies. These measures reduce the risk of illness and mitigate their impact on us by enhancing the immune system, reducing exposure to pathogens, and improving overall health. A healthy body is better equipped to defend against disease agents, thereby minimizing the risk of illness and its consequences if contracted. In conclusion, by adopting these preventive measures, we can significantly reduce the risk and impact of respiratory diseases on our lives. It's a collective effort that not only involves taking care of our health but also contributing to the health and well-being of the community. Remember, prevention is always better than cure, and a little effort in maintaining a healthy lifestyle and hygiene can go a long way in protecting us from various respiratory illnesses. I encourage you to join us in the next video, where we will delve deeper into each of these diseases, understanding their causes, symptoms, and more detailed preventive measures. This knowledge will empower us to take even more effective steps in safeguarding our health and that of those around us. Stay tuned, and let's continue to strive for a healthier, disease-free life.